Dan, could you start my video, please? It won't let me.
You're now live, Chair.
Thank you very much. Welcome everybody to the Local Outbreak Engagement Board, 30th April 2021. For those that don't know me, I'm Councillor Steve Criswell and I chair the Communities and Partnerships Committee at Cambridgeshire County Council and am now co-chairing this board. So I'd like to begin by welcoming those members of the public and press who are watching the live stream of this meeting via Cambridgeshire County Council's website. There's always a risk that we may run into technical problems, and I would ask for your patience if we do so. Should this occur, I will declare an adjournment while the fault is addressed and the public broadcast will be paused. If it's not possible to address the fault, the meeting may be abandoned until such time it can be reconvened. Can I remind members and officers that all virtual meetings are being recorded and that the recording of this meeting will be published on Cambridgeshire County Council's website. For ease, I think I'll take apologies before I do the roll call, if I may. So do we have any apologies, please?
Sorry, we have an apology from Wendy Ogle-Wellborn.
Okay, thank you.
Probably Councillor Fitzgerald.
Yes, was that an apology, Liz, from Councillor Fitzgerald?
He said he would try to join us, but he may unavoidably be late.
Okay, so I'll apologise for being late. Thank you very much then. Okay, so in that case, I'll do the roll call, board members. If you could kindly indicate your presence when I read out your name. Councillor Holditch.
Present.
Councillor Hudson.
Present, Chair.
Dr. Liz Robin.
Present.
Adrian Chapman.
Present.
Charlotte Black. She did indicate she may not be present, I think. So Jan Thomas.
I'm attending for Jan Thomas, Chair.
Thank you. Thank you. So that's yes, Dr. Gary Housen. Thank you very much. Jan, yes. So Gary, yes, we've just done you. Then thank you. Lewis Campher. No. Okay. Councillor Bill Handley.
Present.
Val Moore.
Present.
Councillor Ray Bisbee. No, not present. Thank you very much. I believe we have Gillian Beasley with us.
Present, Chair.
I noticed. Thank you. And myself, Councillor Criswell. Are there any other attendees I've missed off? Okay. No. Thank you very much. So we move on to declarations of interest. Does anyone have any interest to declare either disclosable pecuniary interest or non-statutory disclosable interests? Please indicate if you have. I see no one indicating. Thank you very much. So we'll move on to item 2, which is notes of the meeting of the 2nd of March and the 25th of March. Can I ask if anybody has any comments, or can we indicate that these are accepted as a true record? Please indicate if we have any comments or dissent. No, thank you very much. So we'll assume that the meeting notes for the 2nd of March and 25th of March are approved. Thank you. So we now move on to item 3, which is public questions. I don't believe we have any public questions. Thank you very much. So we move on to item 4. Which is the update on epidemiology and the response. And Dr. Liz Robin, over to you, please. Thank you very much.
Thank you, Councillor Criswell. And I'll ask if Rhiannon could share the screen, please. Oh, thank you, Daniel. So this is a review of the pattern of COVID in Cambridgeshire and Peterborough at the moment. Next slide, please. Starting with the national position, you can see that rates of people testing positive, rates of patients admitted to hospital and deaths are all much lower now, have come right down compared to the peak in January, and indeed are back to sort of some early autumn levels of last year around the country. Looking at the national map, you can see that rates in Cambridgeshire and Peterborough are basically similar to those in surrounding areas at under 50 cases per 100,000 in terms of counties and upper tier local authorities. There is an area with higher rates up further north in the country, and you do tend to see these geographical patterns. Next slide, please. So in Cambridgeshire, the overall case rates, and you can see the case numbers over time on the left-hand graph through from January. And then you can see rates per 100,000 over in the graph on your right. Those case rates fell. They have increased slightly recently, but are now stabilising. And that is very much made up of what's happening in the different parts of Cambridgeshire, which is not consistent. Next slide, please. In Peterborough, I'm pleased to say that overall case rates have declined. They have taken longer to decline in Peterborough, as we know, than elsewhere, but they have declined. And over the past week have really just stabilised. Next slide, please. So digging down a bit into the more varied picture around Cambridgeshire and Peterborough, the cases of COVID, the incidence rates, and also the percentage of cases of tests that are positive. So the percentage of people who get a test who test positive, those are above the England averages in Cambridge, in Fenland, and in Peterborough. And Cambridge actually has the highest case rate at the moment. This is for the week ending the 24th of April, which is our latest reliable data. And that's up at a rate of 65 cases per 100,000, which amongst lower tier local authorities, district and city councils, that's actually the 5th highest rate nationally. So that is unusual for Cambridge, but that is the current position. And that reflects that there has been quite a steep rise in cases there, with a 50% rise over the previous week. We also have above average case rates in Fenland at 42 cases per 100,000. Those have been going down, a fall of 26% over the previous week. And in Peterborough at 46 cases per 100,000, very similar to Fenland. And again, that's fallen over the past week. So that's a varied picture. If you look at the other areas, Huntingdonshire and East Cambridgeshire are particularly low. South Cambridgeshire is around the national average. So we've got this varied picture around the county, but actually in all areas, looking at the big picture, so much lower than when we were back at the peak in January with over 500 cases per 100,000. Next slide, please. So this just shows that in another way, and it teases out the number of cases amongst people over 60. From those of younger and working age people. And the dark orange line is the over 60s, and you can see that those rates are generally lower, and that reflects the success of the vaccination programme, because people in that age group are likely largely to be protected by the vaccine at this stage. So that's positive. Next slide, please. If we look in a little more detail at where those cases are occurring in terms of age, this slide reflects that. Moving from left to right across the slide, you are moving over the time course of the pandemic, moving from the bottom to the top of each chart. You're moving from age 0 to age 90 plus. And yellow is low case rates, purple is high case rates, and you sort of go up through the greens and blues in between. So you can see on the right of each chart, which is the current position, that up in the older age groups, it's sort of yellow-green with the low rates. In Cambridgeshire, you've got higher rates in your younger and working age populations, but particularly when you get to your sort of secondary school and 20 to 24-year-old age group, those have the highest rates. And then in Peterborough, you can also see that it is those sort of secondary school and younger adult age groups and working age groups that have the higher rates. Next slide, please. We like to see at the moment how many people are getting tested, and encourage people to get a lateral flow test twice a week, even if they have no symptoms, because that just helps us to track what's happening and to pick up cases early and stop spread in the community. So we look at the number of lateral flow tests conducted, and also the number of PCR tests, which are for people with symptoms. So the rate of lateral flow tests is stable in Cambridgeshire, and the number of PCR tests is increasing after a decline during the Easter holidays. Next slide, please. And in Peterborough, again, 7-day averages for lateral flow tests, these rapid tests that people do themselves often, are stable. The rates are stable in Peterborough, which is good. And again, we've got number of PCR tests increasing compared to first week of April, so a similar picture. Next slide, please. Overall, you can see there the decline in the number of inpatients in hospitals with COVID. Again, that's very positive, and you can see the actual numbers down written at the side there, but a good decline overall. Next slide, please. You can also see that the numbers of deaths within 28 days of a positive COVID test have decreased both in Cambridgeshire, which is the top chart, and in Peterborough, which is the lower chart, with still a small number of deaths occurring. And that just reminds us that both the hospitalisations, the deaths and the case rates, COVID hasn't gone away. It's improved greatly during lockdown, and it's also improved as a result of the vaccination programme, but it is still here in our communities, and we still need to follow the precautions that we all know, the hands, face space and fresh air, and also follow the current stage that we're at on the roadmap and the restrictions. For example, no social mixing indoors is a really important restriction that's still in operation at the moment. And those roadmap restrictions reflect where we are with the vaccination programme, which is with a lot of older and vulnerable people vaccinated, but not everyone vaccinated yet. So still risk of spread and outbreaks as we're seeing in Cambridge at the moment. That is that reminder. Next slide, please. And this slide, which I've shown you before, gives you that overall picture of total deaths, not just from COVID, in Cambridgeshire on the left and in Peterborough on the right, and where those deaths have increased over the period of the two big waves that we've had, above the average rates for the past 5 years, which are the blue line that you see on each chart. So I think that's a description of the epidemiology. I'll also give you a quick verbal update on some actions that we're taking at the moment. But are there any questions first on the epi?
Any questions, please indicate, board members. I see Councillor Fitzgerald's joined us. Welcome, Wayne.
Hi.
Don't appear to be any questions. Liz, thank you. So perhaps move on to the response. Thank you.
Okay, thank you, Councillor Criswell. So a couple of things I just wanted to feature in the response today. And the first is that we've been doing a lot of work on contact tracing, and we have been employing a larger team of contact tracers within the councils, and that's because we were doing very good contact tracing with staff, both environmental health and staff redeployed from other roles. But as things go back more towards recovery and normal, those staff have to return to all their other jobs. So we've taken on a bigger contact tracing team, and we've also been able, with the lower case rates, to start developing something called backwards contact tracing, which means that we're not just contacting people who a case might have infected. We're able to say to people who've been infected with COVID, who have you been in contact with over a longer period, and where do you think you might have caught the COVID? And that enables us to start doing a real backwards look at the epidemiology, try to establish where people may have caught their COVID from, and to establish linkages between different groups or households of people with COVID, so that we can really see at a granular level how it's spreading. And that backward contact tracing is something we haven't really been able to do until now, because you need lower rates and you need quite a lot of trained staff. And we also, it's not just the contact tracers, it involves our epidemiology, our surveillance cell, our environmental health officers, and a number of other staff. So I've talked to you before about daily surveillance meetings, daily outbreak management meetings that have helped us keep control of COVID in Cambridgeshire and Peterborough. And now we're having daily backwards contact tracing meetings with a range of people involved. We were piloting backward contact tracing last week, really just to get the methodologies right. But at the same time, the rates in Cambridge started to increase. And so we were very much piloting in real life. And that has been enormously helpful in terms of us understanding the linkages between different cases. We get a case listing, but it helped us to really understand the linkages between different cases, different households, make sure that we were making the right interventions, and take proactive, understand how the spread was happening and take proactive steps to prevent it. So particularly in the Cambridge setting, and I have said this in various interviews, we could identify where there had been socialising outside the current lockdown rules, and perhaps people not social distancing when they were getting together, even if they were getting together outside or perhaps going inside and so on. So we were really able to pick up some of the messages that we're now going out to the communities in Cambridge with. Because we do understand much better some of the things that have led to the transmission. So I do feel quite confident going forward that this methodology is a good one. And also the genomic sequencing, which enables us also to trace where a particular sort of COVID line, in a sense, is transmitted between people. There'll be more of that going forward. And as I was saying to Gillian and Adrian this morning, this feels more like what we would do with other illnesses where we've had years of work on it. This is what we do with TB. You know, this starts to feel more like the public health that we've done with many other diseases, rather than giving the very general public health guidance that we've been able to do with COVID. So I'm very encouraged, although obviously I want to see the rates go down in Cambridge and turn around. I'm very encouraged that these techniques are enabling us to really get a grip in a way that hasn't always been possible with COVID, because it's such a new disease and so much research being done. So I'm very confident that you have a very good team doing that, working in partnership with our district and city councils across the whole area. So I wanted to emphasise that as my main point. Also, just to update you, the Health Protection Board has a duty to oversee the local outbreak management plan. And just to assure you that we submitted the plan a little while ago, had a special meeting of this board before it was submitted. There are many parts of that plan that are basically just describing our business as usual. There are other parts which needed to be taken forward with new work at this current time. That included the backward contact tracing, plans to deal with a variant of concern, surge planning, various other specific aspects that needed taking forward. We're keeping a very close eye on that. The plan is progressing well, and you are welcome as a board to ask going forward about any aspect of that plan that you want to particularly engage with and sort of get that public engagement on. But I can assure you that that's being monitored carefully and progressing well. I'll stop there. I'm happy to take questions if there are any.
Thank you very much, Liz. Any questions or comments, please indicate. So just a quick one from me, Liz. The work in Cambridge, are we saying that we're being very direct with our messaging and saying this is where you broke the rules and this is the result of it? We've got an increase in infection here as a direct result of a particular event or particular action?
It's not so much particular events, and the way that I've described it so far, which I think is correct. It's not, people are not doing massive events where you would then sort of move in and say this was very obviously something that gets a big fine or something like that. I think in Cambridge it's more that the rates were very low back in March. So surprisingly low for an urban area. And it seems to me more that people have just relaxed a bit. We've come out of lockdown, it's sunny. people have sort of seen that they've got low rates, they're just relaxing a bit and going beyond the rules. So that's the message that I need to across. And I think you need different messages for different groups. So our expert comms and engagement teams are putting out local messaging in the way that they think will get the most response. Because obviously one needs different messages for different groups, but I am being very clear. Yes, I'm saying when I go on radio or on, I think I've been on both radio and television about this, and I've said I think it is more socializing and it is people going beyond the rules and relaxing too much. So that messaging is getting out there.
Thank you. Val?
Was very similar to your question. Actually, it was about, do we feel communities are learning from the feedback and the experience that they've discovered they've caught COVID in these circumstances? Will it have an effect? Do you think next year you'll see the effects of the outbreaks coming down because communities have understood and started to behave differently? Or do you think there's a danger of things escalating a bit, particularly, for example, in Cambridge, where you've said there are problems?
I think it's always hard to predict the future, Val, and people have many sources of information. So obviously they'll get the local information, they'll get national information. It's important that the information is consistent. My personal view, which has been developed through work in Peterborough, is that a combination of repeated local media work and brand building, which I think our communications team led by Christine has done excellently, that combination together with engaging trusted leaders in individual communities to get the messages across about this is what is happening in our community. Yeah. We need to take those steps. It's that combination that I think seen being effective at different times in different areas. So I'm very confident that some of the direct community engagement in Cambridge is getting messages across. We've had that feedback, and we have also just worked hard to get that message out there about the rise in rates more generally, which means that many people will be more cautious in their behaviour if they sort of realise that rates are going up rather than at that very low rate that they were in March. Yeah. Some people will react to that, not all.
And it was a great TV piece. I saw it. Yeah, well done. Thank you.
Councillor Hudson, Peter.
Thank you, Steve. Question for Liz. Liz, you talk about the people relaxing as the restrictions relax, and they're relaxing too much. Different groups. Is there any indication which group are relaxing more and are sort of mainly to because of this group's actions? We have the large figure in Cambridge City.
That's a good question, Councillor Hudson. And what I would say is that there are sort of different communities and groups, and but what we're seeing as a common factor across those different communities and groups is that relaxation. So it's not just one group. I mean, you can see where the cases are occurring by looking at those age ranges, and you've also got geographical areas that are published. So it's public at MSOA level that East Barnwell and Abbey have seen a high rate, and also the Coleridge area. But you've seen that in Peter as well. You see sort of peaks and troughs in different areas having high rates at different times because the numbers of people involved are not that large. So you get your clusters moving around. What I'd say more in Cambridge, and obviously it's not everyone, it's the people who have become cases, and therefore we have contacted and spoken to. But a common feature, I would say, around those cases is around that sort of relaxation and that general socialising. You're not pinning it down to a sort of a big specific workplace outbreak or something like that. The common factor is the socialising and just going a bit beyond the rules for safe socialising. So it does seem to be a little bit across the board, Councillor Hudson, in terms of the people who are getting the COVID. And clearly there may be many people following the rules who are not catching COVID as a result.
Thank you.
Thank you. Any further questions, board members, or comments? Okay, I see no one. So are we all happy that we've noted the contents of the report? Okay, thank you. We'll take those as noted. Thank you very much. In which case we move on to item 5, and the reports on pages 21 to 28 of our papers. Overview of committed funding from the Test and Trace and Contain Outbreak Management Fund. Can I invite Kate Parker, the Head of Public Health Business Programming, please, to present the report. Welcome, Kate. Thank you.
Thank you, Councillor Criswell. So we last brought you a report back in February, and so this is an updated report, and I just wanted to give you a quick recap on the grants. So this report talks to you about the grants awarded through Test and Trace, which we received during the first lockdown, and that was 3.5 million between both Cambridgeshire County Council and Peterborough City Council. And then we received the Contain Outbreak Management Fund grant, which came in again between the two councils. This was when we went into our first kind of tier system, and that was around 21.8 million that we've received from central government. The governance behind these grants is through the Health Protection Board, and we have a finance subgroup that sits under that Health Protection Board. And that has representations from both Peterborough and Cambridgeshire Council's finance departments. We've got the Director of Public Health, Director of Digital Customers, and our partners included are representatives from the CCG and the districts. And they're the ones that make the decisions on the grants that they receive and check them against the grant criteria that we have. What you'll see in Appendix A is a really detailed breakdown of where the money has gone and been committed to, and it's through a range of different initiatives within both councils, and also some voluntary sector partners have put bids in and business cases in, and they all are measured against the conf grant guidelines. The paper actually highlights to you some of the achievements that we've made, and some of those achievements we've actually brought to you in the past. So in particular, you've had a very comprehensive reports on the communication programs and the campaigns, and the board's really inputted into how that was developed and delivered locally. So we've also got the opportunity there to kind of in the paper, it does describe to you some of the other kind of achievements that we've had. But what I wanted to really focus on was the future investment priorities, because we still have, as you will note from Appendix A, a significant amount of money. But we do need to look at future investments and priorities. Now, this grant lasts until March 2022, but we need to continue to fund a robust infrastructure for our COVID prevention. And we want to continue along the lines of using it for the test, trace, isolate and support approach that has led to much of the initiatives that we have been delivering. So we've got some emerging issues. So we think that there'll be funding that we need to invest in future around variants of concerns. And we'll also need to be looking at our enduring transmission areas. So there are some grants and business cases that are being worked up at the moment. But really, I wanted this as an opportunity for the board to look at the Appendix A, and if there was any particular business cases that you saw on there that you were particularly interested in actually having more formal reports coming back to the board at future meetings, there was an opportunity for you to kind of ask for that. I do have to kind of put my hands up. My job is to kind of approve and monitor the grant, so I don't have the full details behind a lot of these business cases, but I will try and answer any questions that you put towards me, because hopefully there is a bit of an explanation in Appendix A as to what those grants were all spent on.
Thank you, Kate. So questions, comments, anyone? Please indicate. Adrian.
Thanks, Chair. I've kind of got an observation, really, more than a question, and that is that I think what's really powerful about the information that's been presented to us is the way that we've been able, as a system, to make full use of this funding, which is very generous on face value, but actually, and to Liz's commentary actually earlier around the current response, how we've been able to use that funding to build what I think is a really strong and sustainable system. Sort of starting with how we support testing capacity, testing take-up, through to supporting people to self-isolate. More recently, helping with vaccine confidence work and vaccine hesitancy, And then the whole contact tracing piece, particularly the new kind of latest backward contact tracing piece, which has just given us such a wealth of information we didn't have before. And then the whole thing underwritten by really strong community-facing work, lots of communications and media activity to underpin the messaging, and the fact that, as Kate mentioned, the funding has been dispersed across our system. I think we should be proud actually of the way that we've really used this investment wisely. But actually, what we've created is a system which is robust, and there is an argument around what happens on the 1st of April 2022, if and when the funding ceases. But I think we've probably got enough mainstreamed ideas and plans to ensure that there is continuation beyond COVID. Hopefully by then we won't be in a pandemic, but COVID might be a feature of our lives, and actually we need to retain some of the features that this investment has allowed us to get going. So I'm really confident that there won't be a cliff edge of any significance to be concerned about. So yeah, I just wanted to reflect that really, that I think we should be proud of the way our system has taken this money and used it wisely.
Thank you, Adrian. I note in the recommendations we're being asked what we would like from future updates and about future challenges. So do I sort of read from what you've just said that we perhaps ought to be a bit more explicit about how the outputs have been changed into outcomes, and perhaps how the experience of the last 12 months will inform what we do over the next 12 months?
I absolutely think so, Chair. I think what, it's tempting to get into the numbers game on this, and that's really important because obviously the funding is designed to manage outbreaks, especially the Contained Outbreak Management Fund element. But actually, it's the outcomes that are more powerful, and we've seen, and I've reported back here many times, the strength of relationships that have been built across our system, enabled through this funding. I've seen huge investment out of this grant into community organisations. Those relationships won't end just because this particular funding stream ends. They've become part of our psyche now and our way of working. So, and then, individual outcomes for whole communities, I think are really palpable and very powerful. So I think the outputs are important, but I think moreover, it's the big difference that we're making in our county in Peterborough that really we should be really proud of. And I think we should keep an eye on making sure that we continue to achieve, regardless of whether this funding exists in the future.
Thank you, Adrian. Gary?
Yeah, thank you, Chair. I don't want to detract in any way from what Adrian's just said, because I agree entirely. It is about the outcomes and relationships, and the speed at which these services have been set up, and the way people have worked together has been phenomenal. I think in terms of what the board needs to hear about as we move forward, obviously the future isn't predictable at the moment, and there is a risk of further outbreaks as variants come through, and depending on how well we can maintain transmission. So I think the board will need to be assured of readiness to be able to scale up this activity again, should it be necessary. So from my point of view, I think that would be quite useful to see as we move forwards, and especially as we get towards the end of the financial year, and the funding may not be so well documented or understood for next year, but we still need to maintain the ability to scale up. So something around that, Kate, would be really helpful as we move through the year, please. Thank you.
Yeah.
Thank you, Gary. So any other suggestions, Liz?
Yes, it's just to completely support what both Adrian and Gary have said. I think Adrian's description of a system that has come together and really worked together is absolutely what the past year has been, and it's been very good to work in that system as a Director of Public Health with all the support that has come through. One thing I'd just say about outcomes, it's true of many things that we do, but it's sometimes quite hard to demonstrate what you've prevented. So we can look at our sort of our risk factors and our overall COVID rates and make an estimation of whether this, the extent to which this work that we've put in has resulted in outcomes and reduced the spread of COVID. But it's not simple, and to some extent it has to be about we have tried very hard, we've done the right things, we've done the prevention work, the enforcement, the outbreak management, the support, and we will have to accept that it may not be possible to link every funding stream to a very clearly defined set of outcomes, because the overall outcomes is trying to reduce the number of people who are very ill or who die from COVID. That's been the overall measure. But it's, yeah, we'll have to do what we call some proximal outcomes, I think, as we assess it. But I absolutely support the point about the system work. And Gary, echo your concerns about the need for surge planning in the event of higher numbers of cases or a variant having an impact. Both those plans are under development as part of the local outbreak management plan. They're on the in development now sort of area of the plan. So I'm sure that it would be possible to bring something on that back to the board in future.
Thank you, Liz. Bill Handley.
Thank you. I would just make an observation. I mean, I think we're going to have to do a lessons learned thing at the end of all this, obviously. I mean, one thing that just we found quite difficult to begin with was the engagement of some of the parish councils. And I think that parish councils, it's been very patchy. In some cases, they were absolutely up to the mark and responded quickly and liaised with their community groups and so on. And others were completely passive. And, you know, it really would be helpful if we could look at that and perhaps encourage parish councils to have a sort of a pandemic plan for the future that works at the parish level. I mean, I've no doubt there'll be a strategic one. I've no doubt about that. But it needs to get right down to the parish, drill right down to the parish level.
Yes, I can identify with that, Bill. Having 9 parishes in my division, a huge range of responses from those from very active to not at all. So completely recognise that. Councillor Holditch, John. You need to unmute, John.
Yes, okay, I'm with you. I saw something on the telly last night which I thought was quite useful, both in rural areas and in city areas. In those that we are finding hard to attract to have a vaccine, they put it all on a bus and they take it to those places which you know, either got lack of transport things or they're culturally not getting into, so they can actually knock on the door and say, "Oh, if you come out now, you can have it now." I thought that was quite a good idea to have a bus. I see Adrian smiling. He'd like to be the conductor, I should think, but and I'll be the driver. You know, that's it. Up away we go. So I just thought it was a good idea and worth considering.
Thank you, John. And actually, in Cambridgeshire, Adrian's got a bus. So over to you, Adrian.
Thank you. That's very, very true. We took delivery this week, did we not? And just on that, I wasn't going to come in on this, but just to reassure the board, we are with our CCG colleagues just in the process of procuring a bus for that very purpose, of taking vaccines to people. And one of the great strengths of the work we've done, and nationally and locally, is the vaccination rollout, of course, which has hit so many people just at the right time, and the results I think are before us today partly, and the EPI that Liz has shared, but there are lots of groups still that we're a bit anxious about and where numbers are. So the bus will help along with other ideas that we've got, and maybe at our next local outbreak engagement board we can
see what I do with secretaries.
We can bring a fuller update here to that on that subject. I did just want, if I may, Chair, just to comment on the outcomes outputs debate, and just to say that, and I agree with Liz completely, it's really hard, and this is what I grapple with in my day job, day in, day out, how you evidence the impact of your work on a hard output. Does it save a life? Does it prevent intervention from social care? Does it save money? So, and I think that's obviously really important, particularly saving lives in relation to COVID, but also I don't think we should be afraid to tell stories. Use qualitative information to describe the impact this funding has had, how it's brought communities together, how those communities will continue to support each other going forwards. I'm quite sure that there's been a sea change in those parishes, Bill, that you mentioned that have been really active, and we should be proud of those. That will continue, I'm sure, in perpetuity. So I think stories alongside the hard outputs are really important, and making sure we include that in any review we carry out, I think is going to be vital to tell the full tale of the experience of communities in Cambridgeshire and Peterborough.
Thank you, Adrian. Any other comments, board members? Okay, thank you. Nobody indicating. So, Kate, hopefully you've got an indication of what board members would like, perhaps in future reports, and acknowledging the challenges going forward, what we've learnt so far and how we'll use that in the future.
Yes, thank you ever so much. Thank you.
Okay, thank you. So, members, are we happy that we've fulfilled the recommendations? We're happy with those on identifying what the board would like for further updates and the current activity and future challenges. We're happy with those. We note those recommendations. Thank you very much. Okay. Thank you very much. So we move on to item 6, which is any other business. And actually from the chair, I'd like to say I'm aware this is Dr. Liz Robin's last meeting, so I'm sure board members would want to join with me in thanking Liz very much for the huge contribution she's made to the well-being of residents of Cambridgeshire and Peterborough, and certainly wishing you a healthy and happy retirement, Liz. Thank you.
Agreed.
My phone goes off, so somebody's agreeing, obviously. Peter.
I agree. Yeah.
Thank you, Steve. You just beat me to it there, really. I've just attended a meeting this morning, Liz's last meeting with the Public Health Directorate. And I'd just like to say officially on behalf of the County Council Public Health Committee, what a fantastic director of music. That was my old job, sorry. Director of Public Health. Sorry, yeah, Freudian slip, sorry. Director of Public Health Liz has been, and how fantastic she's been to work with. Her commitment, her leadership is second to none. And our Public Health Directorate is absolutely well known for our Public Health England, the National Health Service, and the Department for Health for being as excellent as it is. And that is all down to Liz Robin's leadership. Her brain must be massive. I don't know how she fits a massive brain in that quite petite head of yours, Liz, but her way of getting the facts, and then again, she gets the facts really complicated, and then she can explain it to people like me so we understand them. And it's because of that we've had such a successful health committee this last 4 to 8 years at the County Council. So I just want to say a personal thank you to Liz for your friendship, for your help, for your advice, especially when I get a bit grumpy and shouty, and you calm me down and point me in the right direction. So thank you for that. I shall miss you enormously. All the very best to your family and your mother. And the next time I'm in Cambridge, and if we bump into each other, we'll do something non-public health and have a drink. Thank you.
Thank you, Councillor Hudson, and I look forward to meeting you at an outdoor seat in a pub. Yep.
And sorry you've had to put up with Councillor Hudson's grumpiness, Liz. Okay, members, any other business apart from thanking Liz? Okay.
I'd just like to thank everyone on this board, if that's okay, Councillor Criswell. I think the way that councillors have engaged with and really understood what's going on with COVID, conveyed the messages out there, and have provided the support for officers to do the right thing. And I would say, thanks to all of you for having just supported us to do that, and really helped us, really communicated, the right messages that has helped our local residents forward. And as I say, everyone on this board, I think has been an amazing team. So, and I'll say goodbye now, but goodbye with a very big thank you and very good wishes for the future.
And enjoy your retirement, Liz.
Thank you.
Thank you very much, Liz. And obviously I've only just joined this board, but I think during COVID, the whole of the public sectors worked together as a team, and that's a credit to everybody on this board that's been part of that. So thank you very much. So with that, members, the The date of the next meeting is still to be confirmed, but I'll now close the meeting and say goodbye to you all. Thank you very much.